All right, let's see. I'm gonna make sure that we're live. It's saying that we're live now. Mhm. I'm just making sure that it is showing up. And we are live. We are. Good morning, good morning, good morning. I hope to see some of you come in here real soon to just sit and have a conversation with us about this topic. Before I get into the introduction and we really get into the conversation, let me just give you guys a little background of how this conversation or how this topic came up about postpartum preeclampsia and postpartum depression. We had a family emergency a few months ago, and I, along with my sister and my niece Letitia, who is on here now, we were sitting around the house and we was having a conversation. And Letitia made the comment that this is not talked about that much, and it sat with me for a couple of days. And I called Letitia. I said, what you said, it stayed with me. So we're going to have this conversation. Because one of the things that she pointed out was that this is something that is really, really, uh, really affects the African American community as far as women that are pregnant or having children or have had children. So this is how this conversation came up about understanding postpartum preeclampsia and postpartum depression and how it can relate. So as before we get started, I just ask that if you have a question at any point in time during any one of our speakers and the information that they're putting out, please make it a general question. Any specific questions that is really for yourself, we ask that you leave that for whoever your primary care doctor is. But it is a generalized question. Please feel free to ask that general question. So I'm going to get started by introducing myself, and then I will go around and I will introduce the rest of the panel. So while you're coming on, just say hello. Let us know that you're tuning into this conversation. My name is Janet Chalmers, and this is the first It's Mind Boggling Presents for the year 2023. And it is also the first It's Mind Boggling Presents as a nonprofit organization. Woo, woo. All right. So I am the executive director of the organization. And again, this is just the beginning of what we've already been doing. We are going to do more. And our hope and our prayer is to reach as many people as we possibly can when it comes to mental health awareness and mental health wellness. On the panel today, we have, I'm going to let them introduce themselves because they can tell them about better than I can. So I'm going to start with Miss Tamika up in my right corner. Tamika, if you would just introduce yourself, please.
Okay, thank you, Miss Janet. Good morning, family. My name is Tamika Whittlesey. I'm a licensed clinical social worker and clinical addiction specialist out here in North Carolina, in Charlotte, North Carolina. I assist, my primary specialty is assisting women with their perinatal mood disorders, which refers to mood disorders that can occur at any stage of pregnancy as well as after pregnancy. Another specialty of mine is grief and trauma, specifically when it comes to child loss, as well as fertility issues. And then another specialty of mine is just dealing with intergenerational trauma and stress as it occurs with Black women.
Oh, wow. Thank you so much, Tamika. I appreciate you joining us this morning and, just giving us your expertise and what you know about this particular topic. Now I'm going to move to Miss Stephanie and allow her to introduce herself to us. Miss Stephanie, can you hear me, Stephanie? Oh, she can't hear me. Okay. All right, go ahead, Tisha. Go ahead and introduce yourself.
Good morning. My name is Letitia Dorsey. I experienced postpartum eclampsia in 2017 after the birth of my second child and had pre-symptoms in 2013 after the birth of my third child. So I'm here to share my experience.
All right, thank you so much for joining, Letitia. I want to try to get Miss Stephanie real quick because I don't think she can hear us. And okay, let me see. Okay, so this is the first of many conversations that we're going to be have. This is just the start of many conversations that we are going to be having. I'm trying to reach out to her as we speak. So while we're trying to get her up, since good morning, Kathy. Good morning, Deborah. Good morning, Yolanda, Valinda, and Evelyn. Thank you guys so much for joining us. I'm gonna go ahead and start off with our testimony. Letitia, she is our storyteller for this morning. I wanted her to kind of give us a background of what she experienced when she went through her preeclampsia, what happened when she went through hers. So go ahead, Letitia, and tell us your story.
Okay, my daughter said I said 2017 earlier. I'm sorry, it's 2007. In 2007, I had my second pregnancy. My first pregnancy was normal. Second pregnancy was also very normal. Had her full term, normal pregnancy, normal delivery. About 2 weeks after I gave birth, I began having really, really bad headaches, mostly in the evenings. Took medicine and went to sleep. By the time I woke up, they were fine. My head was fine. This went on for about a week. Never thought anything of it, maybe just tired. I also had a younger daughter at home with me. So just, getting back into the routine of having a baby and a newborn and a 4-year-old. I'm tired at the end of the day. I didn't think anything of it. One Sunday evening, I developed a headache, but this headache was a bit different. I also, I started having blurry vision and couldn't really function. So I reached out to my mom and made a phone call and said, hey, something isn't right. I can't see. They immediately called other family members to come over. By the time they got to me, I had a seizure and a stroke at home. I was 24 years of age and was transported to the medical center, which is where I learned that I had a stroke, had a seizure, and actually had about a nickel-sized bleed on my brain. Recovery was about 6 months, but I wasn't able to drive or kind of take care of myself. So I ended up staying with my mom, who gave me a lot of support during that time to help bring me back to recovery. Cholesterol and blood pressure was really high, which resulted in me having a stroke.
Wow. Okay. That is, and I remember when this happened. I was not in the United States, just hearing that my 25-year-old niece had just had a stroke. But can I ask you this question real quick, Letitia? We're still working with Miss Stephanie to see what is going on with her, because right now she cannot hear us, but we could hear her a few minutes ago. But so you were talking about your blood pressure and some of the symptoms that you had. Were any of these symptoms happening while you was pregnant or before you was pregnant? And is this something that you had a conversation about that was brought up with your doctor, or was it not brought up because you weren't experiencing any kind of symptoms?
We didn't have a conversation about it. My pregnancy was normal. My blood pressure was always within range. I didn't have any pregnancy related conditions during the pregnancy. At discharge, my blood pressure and all signs were normal. So this happened as a result of being at home. Again, at that point, I was told I couldn't have any more pregnancies because it would happen again. Like I said, I had another pregnancy normal delivery again in 2013. I was considered high risk, and we monitored it. Even at that time, during the pregnancy, my blood pressure and everything all stayed within range. About 2 weeks after delivering him, I started having the same symptoms of headaches. At that point, I immediately went to the emergency room because I was in the beginning stages of postpartum eclampsia again. So I was admitted and given a like a sulfate flush for 24 hours, which brought everything back to normal, and I was discharged to go home.
Oh wow. This is kind of like my first time hearing actually what went on with Letitia. Like I said, I was deployed when I got the message that my 25-year-old niece had a stroke. And I want to say this right here is educating me also, because I think I may have heard of it, but like she said, Letitia was saying, it's not really something that I hear a lot about or that it is talked about. So I'm going to have Miss Stephanie go ahead and introduce herself and get into what preeclampsia is all about. Give us a better understanding about what preeclampsia is all about. Give me a second. I have to type out this while she's okay. And introduce us. Okay. I do apologize for this. All right. So I sent her a text message. Again, this is a subject that is part of the educational mission of what this nonprofit organization is all about. And again, so I'm being educated when it comes to postpartum preeclampsia, postpartum preeclampsia, and postpartum depression. So I'm just going to have her to go ahead and unmute herself. And I have some questions that I wanted to ask her, but she cannot hear us. But y'all know what? This is live, and we just keep on going.
Mm-hmm. Absolutely.
Okay, and while she is getting ready to do that, as she is telling us or talking about this particular subject, I will be typing in the questions that I have for her so that she can just flow along with the conversation. So,
hello, can you guys hear me?
Yes, ma'am, we can hear you.
I still cannot hear you guys. Okay. However, I'm going to go on ahead. My name is Stephanie Brathwaite. I am a family nurse practitioner. I have been in the business for 38, almost 39 years come March. I'm going to start with telling y'all what preeclampsia is. Preeclampsia is a hypertensive crisis during a pregnancy, and it generally occurs around 20 weeks of gestation. All pregnant women need to have their blood pressure checked, and the way you cure preeclampsia is to deliver the baby. The problem then becomes, how viable is that pregnancy? Now, so we try to control preeclampsia with blood pressure medication, fluid. We watch for fluid gain, and bed rest also is another thing that we use so that we can get you through this crisis situation, bring your blood pressure under control, where you nor the baby are strained. Unfortunately, when you develop preeclampsia during pregnancy, your possibilities of having hypertension later on in your life is 80%.
Wow.
And so when you have this, you need to check your blood pressure all the time. If your family is hypertensive, I need you to make sure that your OBGYN is aware of this. You have a family history, so they can do close monitoring during your entire pregnancy. As I said, it generally occurs after 20 weeks of gestation. So as you know, normal gestation period is between 36 and 40 weeks. So we have at least 16 weeks minimum of time that you could be in this crisis. Crises, and the symptoms look like swelling of your legs and feet that never go away, even with rest and elevation. You will start to have headaches. You could even have a seizure. And these are just some of the typical symptoms of the things that happen during preeclampsia. The woman will first notice that her rings don't fit anymore. Clothes are getting even more uncomfortable than they should. Your legs grow in size, and you can actually push into your leg muscles, and you can see what we call edema. There'll be fluid buildup. These are classic signs of what preeclampsia looks like in the pregnant woman. As you know, we've already got an additional 15, 20 pounds around our stomach during this time of pregnancy. So added weight also causes an issue. But the main issue with preeclampsia is the hypertensive crisis. And we have to worry about the mother and then the baby. Mom can die from having high blood pressure, can also stroke during pregnancy. So this is the reason that we need to control our fluid intake, our salt intake, and make sure if we've been put on blood pressure medication that you take that blood pressure medication as prescribed. If you continue to have symptoms like a headache, that swimming feeling, when you get up, you feel like you want to fall over, those are things you need to go back, call your doctor and say, hey, I don't know if this blood pressure medication is working, but these are the symptoms I have. When can I see you? These are the things that we need to do to take care of ourselves. The prevalence in brown skin cultures is higher because we typically already have hypertension in our family genetics. As I told you, that is one of the risk factors of preeclampsia.
Okay, that is some really, really good information, Miss Stephanie. I just sent her
the
text
time
a
frame
message.
is from 20 weeks of gestation on.
Okay,
and
so
that's when we start looking into also if you're going to have gestational diabetes. All of these things are started looking at 20 weeks. Okay. A viable pregnancy is considered 26 weeks of gestation. That is viable. That means that the baby can survive outside of the uterus itself.
Okay.
However, we do not want to deliver any babies at 27 weeks. They have a multitude and a host of problems, the least of all being that their lungs have not developed. So then they have the problem of having to be in an incubator, on respiratory, on life support. All of these things are possible. So we try in the medical profession to lower your blood pressure. The longer the baby is in the womb, the better the chance of survival.
Okay.
But in preeclampsia, that is also increasing the risk of the mother having a stroke or having problems as well. So we need to get the blood pressure and the fluid retention under control.
Okay. All right. Okay. So what I want to do real quick. Okay. I'm sorry. So real quick.
Waiting for the next question. Okay.
Okay. So I kind of went back and looked at, because a lot of things that what she just said is she said a lot about what I have, kind of read and researched in some of the articles. So what I want to do real quick is kind of give you some numbers and show you how, so that you will see when she talks about, the African-American community, the African-American women, where we stand or our in numbers, how we are affected. So this came from a study from Johns Hopkins Medicine. Came from an article that was written in 2021, December 2021. It was a study from the Boston Medical Center, had analyzed information from medical records from a study of 6,069 women, average age of 27 and a half. Now, 2,400 or 76% self-identified Hispanic outside of the U.S. 2,699 out of that, 40.5% Black born outside of the U.S. and 997 Caucasian women or white women, where 22.2% was born outside of the U.S. The numbers, excuse me. So the numbers that were given was the highest, I'm sorry, October 1988 to February 2016 is when the records were, that designates the time frame of the records that were studied from that time frame. So the highest age adjusted Black women, their percentage was 12.4%. Hispanic women was at 8.2%. White women, that number is 7.1%. So as you can see from these numbers and her explanation, that can kind of give you an idea or of why our numbers as the African American community are so high. There are other there's more information out there as to why our numbers are so high. This is just what part of what was read, a part of what was given in that particular article that was written. So I want to go ahead and move over to Tamika. And Tamika we're going to talk about real quick about postpartum depression, because I want to see how all of this can tie together. But before we get into hers, I'm going to give you the statistics that I found when it comes to postpartum depression. Again, this is also from Johns Hopkins Medicine. Postpartum depression says 85% of women will experience mood disturbances. It did not particularly say postpartum depression. It said mood disturbance, which could be anything dealing with postpartum depression or anything dealing with some type of medical health issue. 1 in 7 may experience postpartum depression. 10 to 15% may experience severe postpartum depression. 0.1 to 0.2% may experience postpartum psychosis, which is a little bit more extreme. Well, I ain't gonna say a little bit, which is a lot more extreme than postpartum depression. This right here, from the 1 in 7 may experience postpartum depression. 4 million. This comes from these numbers here. 4 million lives births occurring each year in the U.S., which means that's about 600,000 postpartum depression diagnoses. So that's where I want to go into Tamika. Tamika, can you please explain what it is to have postpartum depression?
Mm-hmm. Okay. So postpartum depression, contrary to popular belief, when people hear after the delivery of the baby, it can occur at any time throughout pregnancy. And it's just revolving around just severe dips in mood, where you have that sense of hopelessness. You're not in just a depressed state where you're just sad for the day. It is at least 2 weeks of just prolonged feeling of being sad, this immersed sadness, this immersed feeling of just desperation, hopelessness. With Black women, symptomology of depression can be different in that while we still have those low periods of deep despair, hopelessness, it also shows up in irritability. It shows up in inability to concentrate, having the brain fog. These are all signs and symptoms of depression, and then of course the relation of having and being pregnant, that is why it's tied to and referred to as postpartum depression. Additionally, it can show up as extreme fatigue, and this can create a difficulty in self-diagnosis or kind of like being aware of it, because we all know that being pregnant, you're gonna be fatigued because you are growing a whole baby, a whole child. But this is, even more kind of like the feeling of like, I can't even get up out of the bed. I'm not able to do what is referred to activities of daily living, meaning that it just becomes so exhausting for me to get up and do my hair, to put on my makeup, to take a shower, to brush my teeth. All of these are additional signs and symptomology of how postpartum depression can show up in us. And when we talk of different medical complications such as preeclampsia, the relation of it is preeclampsia is a traumatic thing that occurs throughout pregnancy. And the way that we react with trauma impacts us. Trauma causes us to, go into the state of fight or flight. Literally, our brain becomes high on cortisol. Cortisol causes inflammation. Inflammation causes us to just be with a higher window of we're without our window of tolerance. So we're operating and just going in survival mode, and then we just kind of like crash. So when we have different things such as preeclampsia or other birth complications, such as, gestational diabetes, very severe morning sickness, et cetera, et cetera, et cetera. These things can cause a strain on our body. And while it causes a strain on our body, it affects our hormonal balance even more so with pregnancy, and then thus presents us with just this state of just immersed despair. And this is not just, specified to depression or postpartum depression. This includes all just perinatal mood disorders. Perinatal mood disorders are any types of disorders that can occur in the perinatal period, meaning throughout pregnancy and then after pregnancy up to 2 years, because we know because your hormones do not regain that regularity up until at least 2 years after pregnancy, and sometimes fluctuates even more if you're doing things such as like breastfeeding. So going back to just perinatal mood disorders, because of health complications such as just pregnancy as it is, different complications such as preeclampsia, it can also cause for postpartum anxiety, where you're just extra fearful and you become, going on to the internet and constantly trying to Google different things. Oh, and it's to a level where it's just constant rumination, or just constant just thinking and harboring on something that may need to be thought about or may need to be brought in concern to, but it's just constantly, and it causes you to feel again on edge. You have this increased irritability. You're unable to attune to your surroundings because of everything. And it can be just very devastating, and it can lead to additional postpartum mood disorders such as postpartum psychosis and et cetera, et cetera, et cetera.
Wow. So, okay. That's,
It is a lot. It is a lot.
wow. Yes. And you really never think about this. And she really explained a lot, and she really explained it into detail. Look, so Tamika, let me ask you, how likely, if someone that listen, if you guys have any questions, again, please feel free to ask a question in the chat or in the comment box. Everybody will see it. The speakers will see them. And again, if it's a general question, feel free. But if it's something specific to you, I just ask that you ask those questions to your primary care doctor, your OBGYN, or whoever it is that you're seeing. But if someone doesn't feel like they're going through, if they're going through eclampsia while they're pregnant, right?
Mm-hmm.
Is it a possibility that if they feel as though that they were not going through any type of depression, can this bring this out? Can it just elevate the depression? It can. Okay. So Absolutely. It can just like bring it to, it can make it surface, basically, I guess you could say. Can it do that?
Absolutely. Anything that is a stressor that our body is attuning to, whether it's physically, our body's in tuning to just trying to navigate just the biology of, preeclampsia, but then also emotionally, our body is trying to just navigate just the, it's painful, it's a struggle. So we refer to this as comorbidity, where it increases the chances of postpartum mood disorder. So if you have you may have a baseline where you have had some anxiety, or you may have some depression. You may have some clinical anxiety and depression. By having a medical diagnosis during your pregnancy, such as preeclampsia, it pushes it way up. The possibility is multiplied tremendously because it's an additional strain and stressor that you are navigating.
So it is important for any woman that is feeling as though they are going through a depression, even during pregnancy, to say to your doctor, I am not okay. I think I need to speak to someone, because you don't want it to linger. You want to know how to handle it. You want to know how to manage it. So I'm going to ask Letitia a question. If she doesn't feel like she wants to answer this question, just say, I'd rather not answer this question. And I know my niece, she ain't gonna hold back. But so Tisha, did you go through any kind of postpartum depression after dealing with, having Miss Autumn? Was Miss Autumn?
It was Autumn.
Having Autumn.
Yeah, I didn't. And it's funny because I asked, me and my mom were talking about it, and I'm like, when I really think about it, the two are kind of connected, because I think about what I went through after the fact. I had to move out of my house because my husband worked, long hour days, and I had 2 kids. So I had to move in with my mom. I had to quit my job because I couldn't drive. So somebody had to take me. So my income was cut. But I had a great support system that helped me get through it, was able to get my kids to school and help take care of me, because and honestly, I couldn't really cook for myself because I had just had a stroke. I had a baby. I couldn't breastfeed because I was on all kind of medication that I didn't want to go into my milk supply. So I couldn't breastfeed. But it was a lot. I was going back and forth to doctor's appointments because, like I said, I had to see specialists because I had blood pressure, cholesterol issues. And then at the time I found out things were going on with my heart that I didn't know about, because it actually weakened my heart. So I had a lot of doctor's appointments that somebody had to take me to. So, I kind of became a patient to everybody because I couldn't really take care of myself. So when I thought about it, I was like, if I had to do that by myself, it could have caused me to go into depression or been a more serious situation than what it already was. And I laughed when she talked about, the after the effect, the trauma. When I get a headache now, it's an ordeal because I immediately go to, is my blood pressure high? Am I about to stroke out again? So even now, she's 15 and he's 9. And that's the first thing that comes to my mind when my blood pressure goes up. Or I get a bad headache, because it's a scary situation to go through.
Yeah. And Tamika, is that something that would normally happen with someone that would,
Absolutely. Absolutely. Because like what Letitia just explained, this is a traumatic event. And with that trauma of the preeclampsia, she's also undergoing trauma of all of the grief surrounding it, the grief of just autonomy. You can't get up and go and just drive yourself to the store. You can't do the different things around the house that you want to do so badly. And there's that sense of like, I feel like I'm a burden towards everybody because I feel like I'm a burden. That makes me sad. I don't want other people to try to, having to like be on my back and bend 24/7. There's that grief of autonomy and that you navigate, that you deal with, that can cause for even more depression. And then, with everything just all put together, just the trauma, the physical pain, the grief surrounding all of these losses that you're experiencing, these additional stressors that become kind of like snowball effect. Now you can't go to work. You have to rely on other means of financial support. Luckily, Letitia had the support, but there's a lot of women that don't have that support. They are literally struggling. Their doctor has ordered them to go on bed rest, but because they have to provide for their children, themselves, their future baby, they end up going to work anyway. So it's a lot. And because of that trauma, end up having postpartum stress disorder, or even if it's not the full diagnosis, symptomology that can be very similar to that, which is, kind of like what Letitia had described. You have like a headache, it goes automatically back to, oh my gosh, like, am I about to have a seizure? Am I about to stroke out? Like, it can be just very intense. And that becomes another thing that can happen throughout the postpartum period after delivery, after you've been healed and everything is good, that you have postpartum stress disorder, or at least symptomology that is similar to it because of that stressful, traumatic experience.
Wow. This is a good question. Sabrina Chalmers Bowen asks over here in the comment section, and I'm going to send this real quick. So if you just give me a second, I'm going to send it to Miss Stephanie and see if she can actually come in and answer that question. Better yet, this is what we have to do, y'all. It's okay. I'm going to text her this question and see if she can come in and answer this question. Because it's a good question. Her question is,
we don't have that many children because we can't afford to have that many children.
I hear
that
you.
Part.
That part. Yeah, that part. I'm trying
Inflation is a...
There it goes. I'm sending it to her. Sabrina's question says, how do you think women in the past dealt with these issues, especially with women such as our mom? My mom, she had 8 children, and most of us are within 1 year of each other. Do you think this is why women of today don't have many children such as our mom?
I'm going to answer Sabrina Chambers' question. She put in there, how do I think these women dealt with it in the past? Unfortunately, in the past, there was a high mortality rate during childbirth. Lots of moms died from hypertension, and the cause wasn't found out until after an autopsy was done or something like that. Okay. So these problems have been going on for years. Now that we have the modern medicine, that we have all the prenatal visits so that we can check on how the mother is actually doing, not only just the fetus. And pregnancy is not an illness. It is a temporary condition, which is natural, but it's for 9 months. During this temporary condition, women not only can develop preeclampsia, posteclampsia also happens. That's where your blood pressure continues to stay high after you've delivered the baby. That's also a maternal crisis for the mother. Now we have to bring that blood pressure down, but how quickly do we bring it down? Because if you drop the blood pressure too quickly, then there's another problem, hypotensive. And then we have to throw in fluids. Now remember, preeclampsia is about retention of fluids and elevated blood pressure. And so now then the doctors have to do a balancing act between how much fluid do we give her, and how much help do we need to support her on her blood pressure. But most women back in the older days, before we had all this modern medicine, prenatal visits and stuff like that, women generally died from preeclampsia along with the child.
Okay. All right. So I'm sending her a question real quick because we're going to start to wind this down.
Yeah. And if I could add to that question,
the other part of her question is, do I think this is why children nowadays, we don't have that many children? I'm not going to say that that's the reason. However, in times past, large families were for farmhands. Mm-hmm. We generally used the children as child labor. That was part of the cost to have a large family. So they participated in chores. They helped with the businesses and stuff like that. So is that the reason that we don't have these large families anymore? I can't say, but what I can tell you is we can't afford it and we know it. It's just that I think that's the consensus. We are not living in rural communities anymore. We're not living on the farms. We live in the city. And so therefore that amount of children are not necessarily needed, but some families still do that. But like I said, then you have to deal with crowding situations, how much food, the lack of things that we don't have as a larger family. But for me to say with any assurity that that's why we don't have as many children, that might not be it. It's just that we have better health care, we have birth control, all of these things combined with the knowledge of what happens to us when we have all these children and how our bodies are affected. These are all things that contribute to the amount of children that we now have, as opposed to when we lived in a more rural setting.
Okay, Tamika, give me 1 second. I'm gonna see. I have an additional question for Miss Stephanie, and then we'll finish up.
I hope I answered that question for you.
Yes. Let me see if she got the other question. I don't think she did. I sent her a text message.
One more question.
Yes.
Would I advise? Would you advise pregnant mothers to talk to their doctors as soon as possible? Absolutely. If there's a blood pressure problem in your family, bring it up. That's part of your family history. A lot of families don't share family history, but one thing we all talk about is having sugar and pressure. And we know what pressure is. That means that your blood pressure is high. So if that's in your family, please inform your doctor of that. If in a prior pregnancy you had preeclampsia, please tell your doctor about that. Those are considered high risk probabilities for the mother. If you've had preeclampsia in previous pregnancies, the likelihood of you having it again is very high. The same with the postpartum problem of postpartum eclampsia. If you've had it before, you'll have it again. Like I said, 80% of these women will develop blood pressure issues later on in their life. So this is something that you will have to monitor from the time you find out about it to the time you leave here. Remember that high blood pressure is called the silent killer because sometimes we don't have any symptoms. We just know that someone took my blood pressure at that time I was at a doctor's appointment and my blood pressure was sky high. Some women don't have any symptoms until they're sitting there in the office. They get their vital signs done and their blood pressure is 200 over 110. And you're trying to figure out, well, don't you have a headache? And she says, no, I feel just fine. And that is how we find it. Some women during preeclampsia will have an excessive amount of fluids, constant headaches, throwing up, nausea, can't balance issues. Those women, of course, that's the first thing we look for is preeclampsia. If that's the problem, let's get our blood pressure back under control and see if we can have an extended pregnancy, because that's what it then becomes. How long can we keep the baby in there and safely maintain the mama's health and the unborn child? Those are the things that happen during that time.
I have a couple of questions. I'm getting a couple of questions from Miss Stephanie, Tamika. So I'm gonna see if
you're fine.
I hope that answered the questions that you have.
Yes. Okay. So go ahead, Tamika. Go ahead with what you were getting ready to say.
Oh, I was just going to piggyback on what Stephanie had said, that in regards to the question that was asked, why do women today's do not have as many children as per prior times, and was just going to piggyback on just the societal construct of, what it meant to have a lot of children. Having a lot of children was a means to acquire wealth, because by having a lot of children, you were able to have hands that were able to work on a farm and do different things. So that was one of the reasons why there's that difference, as well as just more access to services such as Planned Parenthood and birth control, that of course women generations of past didn't have that access to that. So if they became pregnant, they more than likely went full term with that pregnancy if they didn't experience any complications. And additionally, I wanted to also just to snowball on another concept that Stephanie had mentioned, with blood pressure being the silent killer. Another connection, of course, between preeclampsia and just in general postpartum mood disorders. Of course, we hear a lot, like, when you're going through stressful situations, what do people say? You're gonna make my blood pressure go up, right? So tuning and navigating a lot of stressful situations, of course, creates that direct correlation to things such as preeclampsia. So historically, due to just oppression, the different things that as women of color, as Black women, that we deal with on a day-to-day basis, historically we have a lot of higher stressor. So again, there becomes another correlation of not only genetically, but also just within kind of like how we operate and navigate society, due to the unfortunate discrimination and societal things that we have to deal with, why we have higher instances of developing preeclampsia and other health complications throughout pregnancy.
Thank you so much. I'm gonna cue Stephanie to answer this last question, but I have another sister on here that commented that she went through this in her 7th month with her oldest daughter Tina, but her next 2 births after that were normal. So I'm going to let Stephanie let her know to go ahead and answer the question about a healthy diet.
Yes, a healthy diet will help with preeclampsia. And the reason that is the amount of salt you take in also helps. Talks about the water retention. Remember, I told you water retention is a part of preeclampsia. So if I'm eating a diet low in salt and I'm exercising, I'm getting my fruits and vegetables, drinking my water, please drink your water, drinking my water, and making sure that I maintain a healthy weight, these will also contribute to lowering the problem of preeclampsia. But like I said, remember, preeclampsia is about blood pressure. Blood pressure is hereditary. It has to do with vessel strength and the things that are going on in your heart. Will your diet change? It may be, but heredity is just very strong. So it's not a bad thing to watch and monitor your diet, decrease the amount of salt, exercise, walk, do all these things. But in the end, if preeclampsia is destined in your future, high blood pressure or whatever, the best thing for you to do is follow the doctor's advice. If they say no salt in your diet, it means no salt in your diet. It doesn't mean I can eat these potato chips, but I don't eat the pretzels, okay? It means a low salt diet. You have to then become a label reader, because salt manifests itself as many different things. It doesn't just say salt, it says sodium chloride. These are things you need to look at when you're reading a label. So yes, diet is most important. Exercise is most important. But those prenatal visits, if you don't go and see your doctor during the time that you're pregnant, you are opening yourself up for a whole host of problems, only one of which will be preeclampsia.
Wow. Thank you, Stephanie. Thank you so much. So I truly, truly hope that this was as educational for you as it was for me, even though I cannot have any more children. But it's still open, Letitia, no ma'am. But it still opened my eyes to a lot of things that I had no clue about. So I thank you, Tamika, for your wisdom. I thank you for your kindness. I thank you for your time. It does not go unnoticed. Letitia, I thank you for your story. I remember the day again that I received a message that my niece had a stroke. And I'm like, how in the world? I was in Iraq for the second time when I got this message. And that same day, I also received a message that I had to go take care of the personal effects of a soldier that had committed suicide. So I had to block one out so that I could take care of the other one. But Letitia, I was still there with you. I was still praying for you. Okay. Stephanie, she cannot hear me, so I will call her as soon as this is over. Thank you all so much for joining. This is what this nonprofit is all about. It is having open, honest conversations when it comes to mental health issues and how even some things can tie into having mental health issues. It is very important. It is very imperative to one, not only ask the questions, but to take care of yourself and become educated about anything that you are dealing with. Personally, I've come more educated about things that I go through than I did when I first found out when I was going through them. I had no idea what it was. But because I have educated myself, I have come to better manage things that I have dealt with and what I am dealing with. So thank you so much. Oh, I have one question for Tamika. Can men develop postpartum depression?
Absolutely. It is not it is not specified for women. Men can definitely develop postpartum depression because even with women going through, of course, the gestational period of actually delivering and carrying the baby and the different hormonal imbalances that arise with that. Men also go through a hormonal, some men can go through a spike in hormonal changes. Their testosterone decreases and their estrogen increases because in a kind of like an adaptive way to be able to provide the care that's needed for the baby that is to come. So you have that just genetically things that are going on that can affect postpartum depression. And then of course, men deal with a lot of stressors as well. Historically, they are the provider. They are the person that may be doing the caregiving responsibilities. If their partner, who is a woman, is, encountering the difficulty of pregnancy due to preeclampsia or other different things. So to answer your question, men definitely can or males can have postpartum depression. And it's something that needs to be talked to within all genders, because
Absolutely.
it is an epidemic and it is killing our people.
Absolutely. Absolutely. Exactly what she said. So fellas, guys, if you go back and you look at this, or if you're on here now and you're feeling as though you are going through postpartum depression, don't think it's just for women. Please do not hesitate. It is okay to say that I am not okay. I need help, and I need to go and speak to someone. That's why we have people like Tamika and other, social workers and therapists and stuff like that. It is okay to have a therapist. I got one. So, and I say it all the time. So thank you guys so much. We are in that hour now. Thank you so much again for y'all being part of this panel. Thank you for everybody that jumped online and joined this conversation and asked your questions and kept the conversations going. There is more to come. I appreciate y'all. I appreciate y'all. I thank y'all. Have a wonderful, wonderful, wonderful Saturday. Remember that it is okay to say that you are not okay. And it is very, very important when you're going through a pregnancy to take care of yourself. Pay attention to the size of your body. Pay attention to the signs of your body. And if you feel as though you need to seek help, or if there is something going that just don't feel right, please make sure that you are talking to your doctors and asking those questions, because ladies, we are birthing some mighty children, some future doctors and some future nurses and some future social workers and some future teachers and educators. Okay, so we have to make sure that we are taking care of ourselves before they get here. Okay. All right. Thank you guys so much for joining me. I appreciate if you guys would just stay on. I'm just going to end the live broadcast, and I will let you guys know the next It's Mind Boggling Present is going to be in person in a couple of months, but I will be streaming that live, and some other things that's coming up. But again, we are now a nonprofit organization with the mission of continuously educating people on mental health and providing education and resources for those that are having mental health issues. So thank you so very much. I appreciate y'all. Have a wonderful, wonderful Saturday for everyone that has joined online. And I will talk to you guys as soon as I end this broadcast. Okay. All right. Thank you.